Good evening, everybody. I'm Brian Nestor, President and Chief Executive Officer of Lehigh Valley Health Network. Obviously, always, I was chatting with some folks ahead of time. This begins the holiday season for my family. So this is a really, really important night, and we have great attendance. So glad you all could make it, and glad it's not going to be 1 degree like it will be Saturday night. So not too bad this evening. But today is the first day of winter, and therefore the longest night of the year. And that's why we use this date to gather to celebrate, if you will, the National Homeless Persons Memorial Day. It's a time to remember our street neighbors and their fight on the streets, and remember those that lost that fight on the streets. And their names are depicted up here on this wall. The past few years have been difficult for all of us. For many of our citizens, that's for sure. They've been even harder for those dealing with homelessness. Homelessness, as you know, contributes to many health issues and sadly takes people out of the prime of their life, dying much earlier than the life expectancy for most Americans. And if you take a moment just to read over the names and how old they were when they passed, you'll see that very clearly. Many people in their 30s, 40s, and 50s starts to get old for a homeless person. So driven by the fundamental principle here that everybody matters, the VHP, Valley Health Partners Street Medicine Team, continues to provide the medical and patient-centered care that these individuals both need and deserve. I'm humbled by their dedication and their compassion, and I'm proud that LVHN continues to support their mission. Members of the team, and many members of the team tonight. So great to see so many of those that actually do this work here with us this evening. They've been doing a heroic job through COVID-19, bringing vaccinations and extra care and flu shots to where people live on the streets. The work of VHP, again, Valley Health Partners, VHP as an abbreviation, the street medicine team at VHP is simply extraordinary. And Josh Rivera, who you'll hear from a little bit, has a unique title, VHP Street Medicine Criminal Justice Navigator. You'll hear a little bit more about that. He'll speak about his specific role in helping our neighbors on the streets just a little bit, make their lives a little easier. To all of you on the VHP Street Medicine team, as you know, you have my wife Tina and my praise, and you're in our thoughts every single day. You truly impact the lives of people in our community who need us the most. So without further ado, let me introduce my wife, Dr. Tina Nestor.
Thank you, Brian. Good evening, everyone, and thank you so much for taking the time to be here tonight. Today marks 32 years that people across our nation have come together on December 21st to observe National Homeless Persons Memorial Day. December 21st was appropriately chosen, as Brian said earlier, because it is the first day of winter and also the longest night of the year. With each passing year, this evening becomes more meaningful, sadly, because of the growing number of people experiencing homelessness across our country. This day is very near and dear to both Brian and me. We became painfully familiar with homelessness while working as emergency medicine physicians in Philadelphia, where we treated many homeless people. But we had no idea of the magnitude of this problem in the Lehigh Valley, despite my being born and raised here. Today, Brian and I are humbled to once again co-host with Valley Health Partners Street Medicine. This incredible team works together with countless community partners to make a real difference in the lives of our street neighbors. You may remember me sharing this thought in prior years, that in our faith, when someone passes away, we pay our respects and pray by saying, "May their memory be eternal." Tonight, while we continue to battle the tragedy of homelessness, we humbly maintain this remembrance wall at LVHN One City Center, with the hope that it will help keep eternal the memories of those who perished on our streets. Now I would like to introduce Dr. Joseph Yozviak, Chief Medical Officer for Valley Health Partners.
Thank you, Tina. I'm Jody Yozviak, the Chief Medical Officer of Valley Health Partners Community Health Center. Valley Health Partners is a federally qualified health center lookalike, which is an organization that provides comprehensive primary care along with other services such as interpretation, transportation, and health education for the community. VHP does not turn people away based on their ability to pay, making sure that financial reasons are not a barrier to receiving care. It is our mission to partner with the people of our community to achieve health and wellness through the delivery of extraordinary care that is compassionate, accessible, and affordable in a family-centered and culturally sensitive environment. We provide whole-person care, focusing on the numerous social factors that play an extremely important role in the health outcomes of our community. All of this makes VHP the perfect home for our street medicine program. As we stand here on this longest night of the year, we're reminded of the toll that winter nights can take on those experiencing homelessness in our community. And I'm reminded of our health center's responsibility to ensure that VHP Street Medicine has the people and resources it needs to provide that care and meet those needs, whatever they may be and wherever they may be. For those sleeping outdoors, this goes beyond ensuring we have competent advanced practice clinicians and physicians. We need to staff nurses and behavioral health specialists, case managers, and social workers, all of whom excel at performing their jobs in any location, whether it be a shelter, a soup kitchen, under a bridge, or in the woods. And it also means supporting those who are struggling with substance use along with homelessness by partnering with certified recovery specialists and clinicians who are skilled to provide that expertise, expert treatment and care. Through providing care with compassion and forging connectedness by giving respect to a community that often receives none, Valley Health Partners Street Medicine truly embodies the mission and vision of our health center. And now I'd like to introduce Dr. Mary Stock, Medical Director for the Valley Health Partners Street Medicine Program and our Senior Medical Director.
Good evening. I was asked to speak briefly on the why of the street medicine team. When I think of street medicine in the Lehigh Valley, the first words that come to my mind are go to the people. It's not simply a tagline for the Street Medicine Institute, it's a way of life for the street medicine team at Valley Health Partners, as is a few other things that I hear often with this team, such as be authentic, be your true self when you go out in the streets. These people can sense your insecurities and your insincerities, and you won't get anywhere unless you're true to yourself. Stand in solidarity with those meeting life under these most significant challenges, and that each person has inherent worth and dignity. I also hear this team asking a lot of questions such as, what did we learn from this patient? Because our patients are our greatest teachers. And difficult questions such as, what does the care and acceptance of those persons experiencing homelessness say about the values we have as a society, and how do we confront that every day? But one of my favorite lines I keep hearing in the street medicine team is, once you see it, you can't unsee it. Simply put, why we do this work is to allow patients to reclaim their dignity in a life filled with indignities. The work of this team shines a light into dark spaces, both of individuals struggling at the margins of society and within the systems that create those margins. The remembrance of those lost is fitting for the dark time of the year, and the work goes on, as does the cycle of the return of the light. Street medicine will continue using their collective light for our patients, for each other, and for each of us in this wildly connected community. And now I was supposed to be introducing Josh Rivera to read the names. He is our criminal justice navigator, specializing in connecting our patients through their experiences with the criminal justice system as they move in and out of that system to make sure that they keep their dignity and that we keep them in mind. However, it is the season of viral infections, and Josh has no voice. So instead, please welcome Nani Cuadrado, a longtime street medicine clinician, to read this year's names.
Oh gosh, I have to read small print. Well, we stand here gathered on the longest night of the year this winter season to honor those who've been lost outside in the streets of 2022. And as was mentioned, I'm filling in for my colleague JJ, our criminal justice navigator. He lost his voice and I'm pinch hitting, so please bear with me. I wanted to share that I really felt that the whole team felt it was really important for JJ to read these remarks as the criminal justice navigator for the team. Ironically, JJ gives voice to the voiceless, and he doesn't have his voice today. But he was the perfect person to actually be sharing these remarks. And I wanted to share that what we started to realize is that about a third of our patients have been involved in the criminal justice system, and we needed to do better with figuring out how to bridge folks that have been involved in the criminal justice system. But not only that, but how do we keep them from falling through the gaps, and how do we work better with law enforcement? How do we work better with our county jails? How do we work better with the police officers that are out in the streets doing the work that we're trying to do? And how do we also work better with probation officers? So I think JJ's role is so key, and I'm sorry you're not here. I'm really sorry because I'm talking. But I think I'm very grateful to Valley Health Partners for recognizing the value of JJ and recognizing the value of keeping that connection to the most vulnerable. And folks that have been in the criminal justice system are certainly vulnerable. I'm going to digress just a quick second because I had a date today with my husband yesterday, and we went and saw the movie Avatar. And I'm bringing that up because there's a phrase in Avatar where they acknowledge somebody and they say, "I see you." So if anyone's kind of an Avatar geek, it's a very powerful saying. And it's not just a saying that is used in Avatar, but in South Africa, Zulu use it. They say "Sawubona." And it's a very profound meaning of "I see you," because what it does is it carries the importance of recognizing someone's worth and their dignity in each person. It also says, much like we were speaking earlier, I see the whole of you. I see your strengths, I see your weaknesses, I see your life experiences, and I see everything, the pain that you've been through. And so I thought about that when we were watching the movie, and I feel that street medicine does this as well. We see our patients, and we see their pain, and we love on them. And JJ really wanted to share, because of seeing our patients, he really wanted to share two quick stories of two of the folks that have passed. And so I'm going to share those stories on behalf of JJ. So first, Rodney. And Rodney was known by his friends as Shorty, and had this great smile and was just this amazing jokester. He shared his life goal was that he wanted to see his kid. That was his goal that he shared with the team. And so at one medical appointment, Rodney had shared that he needed some shoes. And so we didn't have the shoes with us, and we'd been donated those shoes by Faith Church. So we asked him to meet us at Ripple, our community partner, where we would be able to give him the shoes. And he made it all the way from Whitehall on the bus, came to Ripple, and when he saw his shoes, the smile on his face could have lit up a Christmas tree. And it was so powerful just to see the dignity, the graciousness of Rodney, and I think I will remember that smile. So that was a really great story, JJ, that you thought of for Rodney. The second person I wanted to mention is Daniel. And Daniel was a patient that we first encountered in Allentown, and he was very wary about street medicine. But he was amenable to being seen, which we always consider that a plus. But 2 weeks later, JJ had run into Daniel at the Allentown warming station at the YMCA, and JJ remembered that Daniel had been in Philadelphia. He was raised in Philadelphia, and he remembered that Josh, our certified recovery specialist, also grew up in Philadelphia. So he wanted to kind of make that connection. So by introducing the two of them, Josh got to know Daniel, and the two of them started chatting. And with that experience, Josh learned about Daniel's life experiences. He learned about his pain, And as a result, we learned that David had struggled in the foster system, and as a result was very wary of authority, which completely makes sense. And so, again, by building those relationships and with Josh's help and JJ's insight, we're able to kind of close that connection and create a relationship. And we could tell that when he got his boots, there was this sense of self-worth that just kind of goes beyond the smile. And so that was the story that JJ really wanted to share. So though Daniel and Rodney are just two of the folks who have lived and struggled and died among us, I can say that our patients often feel forgotten, unloved, and invisible. But like the Zulu greeting suggests, we see them as unforgettable, loved, and extraordinary. So we know that homelessness is deadly. Dr. Nestor shared about that, and it's preventable. We also know that there's a disproportionate of those who experience it that are people of color, people who suffer from mental illness and substance use disorder, and people who are victims of violence, and people involved in the criminal justice system. But this work cannot be done alone in a silo. It has to be done with the help of our community. And we are blessed to have been birthed by Lehigh Valley. Thank you. And then continue to have Valley Health Partners executive leadership support. Thank you again, to support our community's most vulnerable. And as I read the names of our patients who have passed away this year while struggling on the streets, we acknowledge them as daughters, mothers, sisters, sons, fathers, and brothers. We saw you. We saw your life experiences, your passions, your pain, your strengths, and your weaknesses. Sawubona, we are certainly better for knowing you. Daniel L. Bradley. Rodney Hochstrasser. Sean Romano. Stephen Barnhard. Taya Boyd. And Thomas Schlenner. While these remembrances have been for those who have lost their lives in the streets, for many, their death in hospice or in a room does not diminish their struggle out in the streets. And the following individuals died this year, but thankfully were not outside. And this is the first time we've actually done this. Usually we acknowledge and honor those who have died in the streets, but we realize that now with the gift of a large team, a lot more folks are getting inside to hospice, getting inside to rooms, and that's all with the thanks of our community partners. So we thought that just because they made it into a room or to hospice, that like the last few days of their lives does not diminish their struggle. So we wanted to acknowledge the folks that died this past year, but that thankfully were not outside. Donald Murphy, Gregory Pizzas, Chimioleski, Juan Ocampo Aldape, Carrie France, Thomas O'Gara, and Ornery Walter Woolley. I'd like to now introduce one of our longtime partners and good friends, the newly ordained Reverend Bob Rapp from Christ Church. Christ UC.
Let us come in a time of prayer. Loving God, you have created us and you know each of us by name. We give thanks for those you have created who have touched our hearts, and tonight we remember our brothers and sisters who have died while living on the streets. We lift them up to you, O God, in prayer. For though we share a common loss, we also share a common truth. Everyone truly does matter. We acknowledge the many blessings of others in our lives, and so we also recognize the blessing that we can be in the lives of others. Strengthen us, we pray, that we would continue to walk with those in need on their life's journey, that they would recognize you and your love for them. Bring reassurance to our street neighbors so they would know that even in the longest of nights, there is still hope in your light of morning. As we continue to think of those who are still outdoors, we humbly ask for guidance and strength as we continue the work necessary, that all our brothers and sisters would have a place on earth to call home. Amen.
Thanks, Reverend Rapp. As we remember those we lost, let's also remember there's still work to be done. Let's do everything that we can to prevent the list of names and of the Remembrance Wall from growing. Thank you for joining us today, and we wish you and your family a happy and healthy holiday season. Thanks for coming tonight.